Back when I was in college, I did a lot of work on a suicide hotline. Something that I just became interested in and just wanted to be involved with an activity that gave back to the community. And it was very interesting to me to try to help people who were suffering through emotional pain and mental health issues at that point. And then as I continued to proceed with my studies in college, I was pretty good in the sciences, so I pursued a degree in medicine. In between my first and second year of medical school, I did a rotation working with children and adolescents in a psychiatric hospital in Des Plaines. And I really enjoyed working with the kids, working with the families, working with adults. And after I had that experience, I started working more closely with the child and adolescent psychiatrists at the University of Illinois Chicago, where I went to medical school at. And they were very good mentors in trying to show me the different ways and the different possibilities in helping families, helping adults, helping children, helping adolescents with various issues with emotional and mental health problems that people suffer with. Generally, I see kids as young as 3 or 4, and all the way up into the late 50s, early 60s adults. So I work with a broad range of ages, a broad range of people, just depending on what it is that they're coming to me for help with. I work with the people at Edgewood, the psychologists, the other therapists there, to provide a kind of well-rounded approach to treatment. So I am assessing people to see if medication may be helpful for them or not, and in conjunction with working with a therapist and taking a look at any psychological testing or psychological treatments that might be helpful to give them the most well-rounded treatment experience. And working as a team, basically. I don't feel that just one approach is the best way to do things. And oftentimes, it'll be saying, no, medicines are not appropriate right now, do the therapy first. And if that doesn't seem to be helpful, then maybe we would consider adding medication, for example, to their treatment. The other ways that I'm working in Edgewood is working with therapists to say, okay, the patient has been doing well with the medication for so many months. Now we need to start to decrease the dose of the medicine. You need to keep working with your therapist as we're coming down off the medicine to make sure that none of those symptoms are returning and that you're continuing to make gains and improvements off of medication. I've got 2 daughters and a wife, and I spend all my free time with them. I've been married now for over 20 years, and two daughters, one in college, one in high school. So I'm just spending time with them, and that's what I enjoy doing.